Hello and welcome to Chapter 13, which is going to cover exercise prescription for muscular fitness. So resistance training has always kind of been around. Traditionally, we've thought of it to enhance a sport that you're playing or to increase muscle size. But currently, we're understanding that it's really important for health and fitness parameters, especially in people who have been untrained. And it's also helping us with glucose metabolism and also management for our body composition. First, we want to understand some terminology. We've got these 4 terms here, so we want to be able to define each one, and this is a part of your study guide. So first, muscular strength. This means that we have maximal force that's produced in a muscle or a muscle group that can generate a specified velocity. So it's one single contraction that is taking place, that maximal force within it. Next, we have muscular endurance. And this is going to be when we have a muscle or muscle group that can perform repeated contractions against submaximal resistance. So this can be anything that is lightweight, but you're able to do many repetitions of, such as rowing in a boat. Next, we have muscular power. Now, muscular power is going to be the rate of performing work and is a product of strength and speed of movement. So we can think of this as the work that your body does over time. A strong upper body can lift a high amount of weight, but a strong upper body is not always going to have the ability to throw shot put very far because it can't get enough speed. Okay, so if you have a lot of power then in your upper body, then you are able to throw that shot put very far. And then certain sports such as weightlifting and boxing and weight throwing, it's going to be one of the most important physical attributes. In certain sports such as football, you have good power that is very important just to have an overall good fitness profile. So let's talk about that word fitness. What does muscular fitness mean? It's basically taking the previous 3 terms and putting them all together in order to get an overall good health and fitness. The next couple slides we'll be talking about maximizing the effectiveness of our resistance training programs. And to do this, we have 4 main principles that will determine this effectiveness. So the first one is progression. Second one is regularity that you see on the screen. Third is overload. And fourth is specificity, which we'll talk about on the next slide. In order to remember these 4 principles, you can think of PROS, P-R-O-S. Each of those letters represents one of the principles. So let's talk about progression first. We've discussed progression already in class, but in general, we want to make sure that we are putting demands on our body in order to see an increase over time for long-term fitness gains. We need to make sure we have that training stimulus in place. This means our exercise programs have to become more challenging instead of just adding more weight on. This is especially important for the first 2 to 3 months of training in order to avoid a plateau. So what you can do for beginners though is increase their weight by 5% to 10%, but when you do this you also want to reduce the repetitions by 2 to 4 reps. Once they master that, then you can go ahead and increase those repetitions again. So for example, if you have a client that does 12 reps of the chest press using 100 pounds, you should increase them to 110 pounds, but instead of doing 12 reps, we're going to decrease their reps to 8 reps in order to gain muscular strength. And we can increase the number of sets, increase the number of reps later when she's kind of mastered the 8 reps. Or we can add another type of chest exercise, such as the dumbbell fly. Next, we have regularity. Regularity just means you're going to perform it regularly, several times a week, because we cannot store any adaptations that we've gained. We always have to work that muscle. So this is just an image showing you our active muscles on the left, and then if we aren't having that regularity component, then we're going to start to see muscle atrophy, or the muscle cells becoming smaller. So we have inactive muscles there. Next, we have our third principle, which is overload, and we've discussed this in class as well. We use this overload principle in order to enhance muscular performance. Our body must exercise at a level beyond that at which it is normally stressed. So we want to make sure in order to do this, we can increase intensity, the total reps, the repetition speed, our rest period, the type of exercise, or our overall training volume. So for example, if you have a client that completes 10 reps with a 20-pound barbell curl, then you can easily increase the weight and reps or sets to increase their arm strength. Next, we have specificity, or as most people know it, as the SAID principle. We're going to see that our most effective programs are going to target specific muscle groups and actions and energy systems, which we'll get into later this quarter. What SAID stands for is going to be specific adaptations to imposed demands. That again was specific adaptations to imposed demands. What that means is every muscle or muscle group has to be trained in order to make gains in strength and local endurance. You can't just do one specific type of exercise and expect the whole body to be stronger. So for example, if you're doing squats, we know that's going to enhance our lower body, but it doesn't really do anything for our upper body. An example would be also a basketball player who needs a lot of complex exercises because the activity that they do, playing basketball, requires a lot of multi-joint or multiplanar movements. Multiplanar movements means we're having movements within our frontal plane, the sagittal plane, and the transverse plane. So before we start designing a program, what we have to consider is health status. When you first take on a client or an athlete, you want to know their previous training status, any past injuries or current injuries, any diseases that are known that are going on, and what their personal goals are. So they'll complete a health and medical questionnaire in order for you to gain this information. We also want to know what their fitness level is. There's something called a training age. Basically, how long have they been training? We know that a 32-year-old that has 5 years of resistance training experience is not going to have or achieve the same strength as someone who is 25 years old with no experience in resistance training. The more experienced a person is, they're going to need more advanced programs in order to gain muscle strength. So if you first take on a client, you want to start them out pretty simple, and as they move through the program, you can give more complex exercises like this one here. We also want to keep in mind what that client or athlete's training goals are for the short term and the long term. We also want to use prior evaluations and their personal goals. You want to make sure that these goals are realistic so that they don't get discouraged or they don't drop out of the program that you are trying to keep them in. Next, we're going to discuss the different types of resistance training. You're probably already familiar with a lot of this, but it's good review. So first we have our isometrics, and this is also known as static resistance training. We're going to see an increase in size that may be limited to the joint angle in this type of training. So if you want to really understand what is going on in this type of training, just go over to a wall near you and you want to try to move that wall. So you're going to put your hands up against it and you're going to push as much as you can to try and move that wall. And so you're going to feel tension that is building up within that muscle. But obviously you're not moving anything. You are not changing your joint angle of, let's say, at your elbow in order to move this, quote, weight. So what this means is that the muscle length is not changing. This is typically used within a clinical setting, which makes it easy because no equipment is necessary, so cost is minimal. MVC here means maximum voluntary contraction, and we're going to perform that at 3 to 5 seconds and 15 to 20 reps in order to get strength gains. And you want to do this about 3 times per week. Sometimes when we are pushing against something, we tend to hold our breath. So you also want to encourage that they are breathing regularly. Another thing that is on your study guide is to know what the Valsalva maneuver is. Valsalva maneuver, you are holding your breath through the sticking point, and that is going to reduce venous return back to the heart and can also increase your systolic blood pressure and diastolic blood pressure. So it's not really recommended to use unless you know what you're doing, and typically it's used in exercises in which you need to kind of build up more of a support for your back. While you do all types of resistance training, you want to make sure to exhale while you are lifting or doing the most difficult part of that exercise. And you want to inhale while you are lowering or the easier part of the exercise. Next, we have dynamic constant external resistance, or DCER. And this is a type of resistance training that's involving lifting and lowering something. So you can typically do this using free weights like barbells or dumbbells. You can also do this using weight machines. These are all dynamic because the weight is being lifted and lowered through a predetermined range of motion. This type of resistance training was also called isotonic. It literally means constant tension. Iso means constant, tonic means tension. So here in the figure on the right, you can see that this gentleman is doing a barbell curl, and the elbow flexors are going to be the strongest at approximately 100 degrees and weakest at 60 degrees when the elbows are fully flexed, and it's also weak at 180 degrees when the elbows are fully flexed. The other type of resistance training we have are isokinetics. These are devices that are designed to train only single joint movements. So they're not really used in fitness centers, but they're used by professionals that are helping with injury rehabilitation, so physical therapists or athletic trainers. And through this isokinetic device, they are going to accelerate at the beginning and decelerate at the end of the range of movement so that they can prevent any further injury from taking place. So it's not really used to gain strength through fast velocities, only slow movement. And it also helps to keep the limb still, so you can add more weight to give it a little bit of a challenge if you're seeing that the patient is doing fine with the weight that you've given them. Next, we have plyometrics, and we're going to have a whole chapter devoted to plyometrics this quarter. So in general, this was known as jump training. This type of muscle action that takes place is also called the stretch shortening cycle exercise. Basically, through doing a lot of jumping or quick movements, we are getting a physiological advantage because our muscle force is generated during the concentric muscle action. So think muscle is shortening, and it's potentiated by a preceding eccentric muscle action. So think of a muscle lengthening. So if you're not really understanding what I'm saying, let's use an example. So if we are doing explosive jumping, you are bending down, and through eccentric muscle action, you are building potential energy within your muscles. And then you shoot up to jump, and that is concentric muscle action. Your muscles are contracting in order to boost you up. You want to be careful when prescribing plyometrics because it can greatly stress muscles, connective tissues, and joints. So you might want to limit the training to people who have established a strong base. And also to start, you would want to do 1 to 2 sets of 6 to 10 reps about 2 days per week on non-consecutive days at a low intensity. And we'll talk about all the different types of plyometrics from low intensity to high intensity. All right, now I want you to pull out that packet that I gave you in class because we are going to talk about modes of resistance training. And each of these listed here, machine weights and on, are different modes. So we're going to talk about the pros and cons of each of these. So first are machine weights. They're designed to train all major muscle groups. The pros are that it's easy to use because the exercise motion is controlled by the machine, and a lot of them are going to mimic what free weights do for us. The cons here are that it's designed to fit an average male or female, so people that are much smaller or larger are not going to properly be able to position themselves on the machine, and so they're not going to get the proper workout. Next, we have our free weights. Free weights, let me switch my picture here. Our advantages here are proper fit is not going to be an issue. We have a greater variety of exercises that we can do in many different directions. We can also require the use of stabilizing and assisting muscles, which I forgot to mention in our machine weight. Our machine weights, we don't have those stabilizing and assisting muscles because the machine kind of takes on a lot of that. So that would be a con for the machine weights. Back to our free weights. Another advantage would be that you are training functionally, meaning that you're encouraging different muscle groups to work together during your exercise. So our cons with free weights is that it may take a little bit longer to master technique using them. You also might need an aid of a spotter, and we will see an increased number of injuries using free weights. Next, we have our body weight exercises. These would be like your push-ups, curls, or pull-ups, or what this gentleman is doing over here. The pro is you don't need any equipment, just your body weight, and you also don't need a lot of space. The cons would be that the ease of it is variable, and also that muscle isolation is going to be variable. Here are our stability balls. The pros here would be that it's inexpensive, we can enhance strength, muscular endurance, and power using these stability balls. And we also get gains in agility, balance, and coordination. It's also lightweight and safe. If you don't have a lot of space at home, you can always deflate this and then reflate it. And there really aren't cons to this. I want you to be careful with the stability ball and our next mode, which is medicine balls. Sometimes people get these mixed up. So the yellow ball here is our medicine ball. And we can use this a lot within our throwing drills. Our advantage would be that it's safe, it's effective, and it mimics natural body positions and movement speeds that we would have within our life or if you are playing a sport. And there really aren't any cons to using medicine balls. And lastly, we have elastic tubing or elastic bands. The advantage for them is that it can be challenging, it could be motivating and fun to use, and there really aren't any cons here to using them. We have to talk about safety issues. A lot of injuries are preventable, but we want to make sure we have the proper supervision and instruction. We want to take care of our environment and the equipment, so it's best to do weekly checks on them and make sure to clean them properly as well. We want to be able to do proper warm-ups about 5 to 10 minutes before we utilize any resistance training equipment. In general, during our warm-up, we want to be able to do something like slow jogging or stationary cycling. And if we're doing dynamic activities, we want to start out with low-intensity hops, skips, or jumps. It's interesting because 27% of emergency room visits that were resistance training related were considered accidental, meaning it was something like dropping a weight, not using equipment properly, or tripping over equipment. And men were the ones that suffered more trunk injuries than women, and women had more foot or leg injuries. Now, when we are setting up a resistance training program, we have 7 factors to consider. So this is going to help you work through your resistance training program lab that I passed out to you in class. So our first factor is the choice of exercise. We've got multi-joint exercises, which are also known as structural exercises. So it's basically what the name insists, is that the exercise you are doing is affecting more than one joint. So examples would be squats and deadlifts. And the other choice is a single joint exercise, so a body part that is specified during the exercise. An example of this would be bicep curls or leg extensions. This typically is used for injury rehab, or if you want to isolate a muscle, or if we have a group of people or clients that are inexperienced, it's good to kind of start out with the single joint. The other choice of exercise we have is to promote balance using our core. So we can use an unstable surface for single and multi-joint exercises using stability balls or wobble boards, and that can increase our activity of our lower body and stabilizing muscles. And usually when we do this, we want to start with a light weight in order to decrease injury. When we strengthen our core, it helps us to improve force output and enhance our body control when we are doing any free weight exercises. And we also might see a decrease in low back pain. To strengthen our core, we can do abdominal curl-ups, or we can do back extensions. We can also involve rotational movements or diagonal patterns if we're using body weight or a medicine ball on a stable or unstable surface. Next, let's talk about order of exercise. When considering our multi-joint versus our single joint, you always want to make sure that that multi-joint exercises come before the single joint in most instances. And that's because we are going to use larger muscle groups when we do the multi-joint exercises, and so we might have a little bit more fatigued with that than compared to our single joint. We also want to choose exercises that are going to be more for power before strength. This was just a slide that we were going to do in class to create a resistance training log and what exercises you would choose to do first, and then what exercises you would choose to do last. So again, multi-joint and power exercises would come first for the most instances, and single joint and strength exercises would come toward the end of an exercise session. Our next factor would be our resistance used. So depending on what the goal is of your client, whether it's strength, hypertrophy, or endurance, that will determine the repetition zone that you're going for. So if somebody wants to have the goal of building muscular strength, they are going to do 3 to 6 reps. If they want hypertrophy, they will do 8 to 12 reps. And if they want endurance, they want to do 15 to 20 reps. You can also use a %1 RM. RM stands for repetition maximum. What that means is for the exercise that you're doing, what is the maximum amount of weight that you can use for that exercise to do 1 rep? For beginners, you want to start off choosing a weight that is 60% to 70% of your 1 RM. If you are intermediate or advanced, then you could do greater than 80% of your 1 RM. And we're going to go through and discuss how to figure out what your 1 RM max is later this quarter. So whatever the goal is, strength, hypertrophy, or endurance, the goal is, in order to maximize your gains of that, to perform until you have volitional fatigue. What that means is you're unable to complete a rep because you become temporarily fatigued. What you end up seeing is that most people can do about 10 reps using 75% of their 1 RM. And you'll also see that most people can complete more reps with large muscle groups than with small muscle groups. Our 4th factor is training volume. So this is going to function as sets, reps, and the amount of weight that is lifted. So in order to figure out what the training volume is, we have to consider the number of exercises that are performed per session, the reps performed per set, and the number of sets performed per exercise. If we have a client that performs 3 sets, 10 reps each with 100 pounds on, let's say, a bench press, then the training volume for them for that exercise will be 3,000 pounds. The way we did that is we took the 3 sets, multiply it by 10 reps, multiply that by 100 pounds. And that's how we get 3,000 pounds as the training volume. Our 5th factor are rest intervals. And typically there are going to be different rest interval recommendations depending on what the goal is. But overall, in summary, we want to make sure that if we're moving heavier loads, that we rest 2 to 3 minutes, may even need more up to 5 minutes. If we're moving lighter loads, then you rest for 1 to 2 minutes. And if necessary, you can go down to 30 seconds. If you're doing something like for muscular endurance, then you could do 30 seconds of rest in between each set. The reason why you have to have your rest intervals is in order to have energy recovery, for your energy to come back in order to continue and not fatigue too quickly. Our 6th factor is repetition velocity. So according to our principle of training specificity, gains in our muscular strength and performance are specific to the training velocity. So if we're talking about fast velocity training, it's going to be more likely to see enhances in speed and power than compared to slow velocity exercises. There are actually 2 different types of slow velocity training. We have unintentional slow velocities that are typically going to be used when we use heavy resistance, and we keep moving slow even though we attempt to exert maximal force. Whereas intentional slow velocity is when a person is training with submaximal load and is purposely moving through the exercise slowly. Usually because we have beginners performing exercises slowly to really understand what they're doing, they're using the intentional slow velocity. So it's really great for untrained people to do this type of repetition velocity. Whew, we finally made it to our 7th factor, which is training frequency. You want to make sure that you do resistance training 2 or 3 days per week per muscle group on non-consecutive days. This allows your muscles to adequately recover between your sessions, so you leave about 48 to 72 hours in between your sessions, and that's been proven to be the most effective for enhancing muscle strength and performance. We, of course, have to take into account the training volume, training intensity, or exercise selection, and nutritional intake, because that's going to have an influence as to how we recover. Here is the American College of Sports Medicine's general resistance training guidelines for healthy adults. They recommend that you do 8 to 10 multi-joint or compound exercises. You train between 2 and 4 sets. You choose a resistance that allows about 8 to 12 reps. You perform these reps with control and use your full range of motion. Of course, you want to use proper technique to minimize any injuries and keep your regular breathing pattern, no Valsalva maneuver, and train each muscle group about 2 or 3 days per week, and use the idea of progressive overload. And throughout the program, you also want to reassess to make sure that you are working toward your muscular fitness goals. Periodization. We are also going to have a whole chapter devoted to this topic. So for now, I just want you to have a general idea of what it encompasses. What periodization is a process where fitness professionals are going to change the training stimulus in order to make sure it stays effective. So your program is going to vary with different variables such as the choice of exercise, your training weight, the number of sets, your rest intervals between the sets, or any of a combination of these for long-term performance gains. So in general, if we are looking at a linear periodized model, then the training plan is divided into time periods. You see these time periods listed here as macrocycle, which is about a year. And that's divided into mesocycles, which are about 3 to 4 months. And that is further divided into microcycles, which is from 1 to 4 weeks. So each of these cycles have a specific goal to them: hypertrophy, strength, or power. So you can see this if you're looking at table 13.4 below. Phase 2 is hypertrophy, phase 3 is strength, and phase 4 is peaking. So you can see within this linear model that we are seeing the volume and intensity of training gradually changing over time. So if we are starting with the beginning of our macro cycle, so think of a year, the beginning of the year with a training volume that is very high, then that means our intensity should be low. And as the year continues, our volume is going to decrease, but intensity is going to increase. Once you finish these 4 phases, then people are encouraged to participate in what's known as active rest, meaning they're doing recreational activities or low-intensity resistance training so that you decrease the chance of overtraining. If we look at table 13.5, we see a non-linear method here. And this basically shows us that there's daily fluctuations in training volume and intensity. So if a person is performing 2 sets of 10 reps with a moderate load on Monday, then 3 sets of 6 reps with a heavy load on Wednesday, and 1 set of 15 reps with a light load on Friday. And by changing up the intensities, then they can minimize their risk of overtraining and maximize the potential for maintaining training-induced strength gains. There are 3 different resistance training systems that I want to discuss. First, we have our single set, also known as high intensity training or HIIT. This is going to be time efficient for people, and it's usually really good for beginners or people who are deconditioned. So you want to have 8 to 12 reps that they complete until they have volitional fatigue. The multi-set system is going to enhance strength and power. We want to do this for 3 sets of 10 reps, building to 10 RM. So a way to do this, for example, would be that your first set of 10 reps are at 50% of 10 RM. Your second set of 10 repetitions would be at 75% of 10 RM. And your third set of 10 repetitions would be at 100% of 10 RM. So that's how we would be building to the 10 RM. And we would say that this is building a light to heavy pyramid because as the system continues, we are increasing the weight progressively. Lastly, we have circuit training. This helps to increase muscular strength and local muscular endurance. And it also helps to improve your cardiorespiratory fitness that we talked about our first week. You could start with 1-minute rest between exercises and gradually reduce the rest until you are in the desired range that your body has adapted to. You also want to make sure you are in about 60% of 1 RM, have about 10 to 15 repetitions. Next, we need to discuss pre-exhaustion. This is forcing target muscle group to work longer and harder. So typically they use it for muscle hypertrophy as a goal. The way you perform this is you use successive sets of 2 exercises targeted for that same muscle group. This is also known as a compound set. It is done back to back. So for example, if you do 1 set bench presses and then go straight to dumbbell flies, then you are developing that chest muscle. Both of those exercises are for the chest, and your pectoralis major muscle there will work longer and harder, and you will see increases in muscle hypertrophy. Doing some resistance training exercises, you might need some assisted training as well. This will allow the lifter to complete 3 to 5 more repetitions after several are performed until volitional fatigue. This isn't recommended for beginners, and you want to make sure that you have a proper spotter that knows what they're doing. Despite what has been discussed in the past, resistance training is actually great for children. It helps with measurable health indexes, their body composition, bone mineral density, insulin sensitivity in overweight youth. It also helps them prepare for the demands of playing a sport, getting that neuromuscular adaptation more likely than getting muscular hypertrophy. And there's also no age limit. As long as the child is old enough to follow instructions and understand the risks so that they don't get injured. What American College of Sports Medicine recommends is to do 8 to 15 reps of each of the exercises. And then I have a video here just demonstrating some exercises. Resistance training is also great for seniors. It can be used to offset losses in bone and muscle mass. Seniors typically start to suffer from sarcopenia, sarco meaning muscle, and penia meaning to lack or have a deficiency. And we see that there is a proportional loss of type 1 and type 2 fibers. So we also have to think of our principle of reversibility here. You are going to either use that muscle or you lose it. Seniors may be frail and need to perform strength before they perform endurance activities, but usually they can increase muscle strength, power, gait speed, balance, and overall function. This will help to reduce potential injuries caused by falls that they may have, and it'll also help their psychological and cognitive thinking. The American College of Sports Medicine recommends 10 to 15 repetitions for each of 8 to 10 exercises, and to do this about 2 days per week. Resistance training can also be great for women who are pregnant. There are some contraindications, and you could see your text for those. But we do know that regular exercise can reduce the risk of developing conditions associated with pregnancy, such as pregnancy-induced hypertension and gestational diabetes mellitus. The American College of Sports Medicine recommends 12 to 15 reps to moderate fatigue, proper breathing, and you want to avoid isometric muscle contractions or the Valsalva maneuver. We want to make sure that blood flow comes back to your heart. You also want to avoid supine exercises after the first trimester. Women who are pregnant after the first trimester should limit or not at all lay on their back in the supine position, because the uterus falls back onto our blood vessels and stops the blood flow back to the heart. They also want to avoid sports and activities if there's a risk of falling, and make sure that the environment is thermoneutral. Once a woman has delivered her baby, she can go ahead and resume her exercises about 4 to 6 weeks post-delivery. Another group that resistance training is great for are adults with CHD or coronary heart disease. Increasing their muscle fitness is going to help to lower myocardial oxygen demand during everyday lifting. So after they've had a heart attack or an episode, they can return to work and leisurely activities such as carrying groceries or gardening. We know that resistance training can favorably affect their muscular strength, endurance, their cardiorespiratory endurance, and cardiac risk factors, and their overall psychosocial well-being. You could see your text for contraindications, and they can start their resistance training beginning at 5 weeks post myocardial infarction or heart attack, or after their surgery, after 4 weeks of supervised endurance training. They can begin with 12 to 15 repetitions and progress to 8 to 12. And we want to train each muscle group for 2 to 4 sets and monitor for appropriate blood pressure responses. You want to stop them if they're feeling any dizziness or dysrhythmias or unusual shortness of breath or angina or chest pain. That is it for the screencast. You are now going to take the Chapter 13 mini quiz online on Blackboard, just to make sure that you have gotten everything you need to out of this PowerPoint. Please always feel free to email me, text me, call me with any questions that you may have in preparation for your exam.